want to say first, welcome to Mental Health Mondays. I'm Dr. Paul, and I have
Thank
a
you.
dear friend of mine who's we've been friends for a while and been on other shows before. She's going to introduce herself. But Mental Health Mondays, it's about talking about mental health and about how we can create solutions, but about recognizing mental health. It seems to be such a problematic word, mental and health. Like, it's not about being mentally strong. It's not about being mentally weak. It's about being mentally health, meaning that understand what you're feeling and thinking and going through and how it results in the body, how it affects you, how it affects the loves in your life, and how you are transmitting, right? Because if you don't understand what you're transmitting, it has a
True.
cause and effect.
So, hi, I'm Dr. Shivani Khetan, and I am working for the mental health in India. I am working in the areas of healing, mental health, and hypnotherapy. And the one thing I really tell everyone is whether you are doing anything, please do a little bit of art every day. Why? Because it will help you to connect with yourself. It just gives you a feeling. You can just have few crayons lying, some papers. Just write what you're feeling. Now, you might be feeling great, you might not be feeling great. At least it will help you to connect with yourself. And this is what I'm doing here, and I'm working a lot with dementia. So thank you, Dr. Paul, for inviting me. You always are very kind to me to get me here. Yes, the time frames are a little weird, but then thank you so much for calling me on this platform. I always enjoy coming here. Thank you.
So, Dr. Shanani, to talk about the dementia that you're working with, talk because my mother, and we were talking about my mom, and before she passed away, she died of a stroke, but the last year and change, she had dementia, and I understand, being this neuroscience geek of me, I understand the proteins and the deficiency that cause a lot of the decay in the brain. But let's talk about the work you're doing with it.
So most of my work started happening with my mother because due to pandemic, the society that I wanted to work with, they were kept inside due to the health reasons. So what we are working on is first we are working on the dimensions of protein that you have said. We have touched the food level of her. We released the carbohydrates from her life, and it has helped her a lot. And as you know, the protein plays a very big role when it comes to your memory. So the food was taxing. There were times when I had to not tell her what I was feeding her. So we had to create food, like we were making some meatballs and telling her we were doing it's a normal ball of a potato or something, and then we had them framed in vegetables and everything. uh, I created an egg tofu for her, and because egg is an integral part to eat every day for her.
Yeah.
So I am creating egg tofus at home, and we tell her that egg is used as binding, but it is full made of eggs. So those kind of things were introduced to her and tossed in a nice way because I cook for her. She was feeling very nice that my daughter is cooking for me. So I was creating my experiments so that she does not know about the smell or something because see,
Right.
she has
Right.
been vegetarian all her life and I have been vegetarian all my life. But now I have switched to a protein diet. So I know how bad it can be when you have not been eating and how a little smell can also put you off. So the food did its part. Then we were doing art therapy with her. Every single day I've done art therapy with her. We have done movement with her. We introduced movement. She started expressing through her body,
Yes.
which which no one tells them. They're very shy. They just sit like this. So we started opening her with her music. I put her into our house where we had a beautiful uh, music playing all the time, and she just, well, you have to see her. There's a whole change in her that has happened, and she was repeating a lot. As you know, the dementia patients only remember the past.
Yes.
If they've eaten also or not, they will just forget like this. We started working on that. We used to ask her, "Are you hungry?" And she said, "No, no." Then slowly, slowly, she became present of her environment, of herself, that no, I've eaten. And then came a part where she started expressing, I like this, I do not like this. I'm not happy to do this. Something which I've never seen her as an Indian woman coming from a middle class family. Women have always and always taken in. They've never given back saying, I do not like this. Like when you started from here, how are you feeling? Being very much connected to your mental health.